Today, I want to, present about this thing. So, our research started as, we asked with our team what would be best in the medical education that we, as a medical student, we just learn about it in the block system, and then we come with this topic, exploring the connection between dietary lifestyle and depression, because, we learn about the gut-brain axis and then the depression. From what the coursework told us, a lot of our guts have a lot of nerves and neurons, and it accounts for a lot of things like that in the tissue. So we believe that it has something to do with our brain and our emotion. So let's explore about it. The depression, as we know it, it affects a lot of people. For some sources, say 5% of all the people, and I believe it even more so in the medical students. And this thing, it is a multifaceted problems, but for the sake of this presentation, we will focus on the dietary facet of it. So, objective of this thing, we want to do the review, aim to evaluate the effectiveness of various dietary intervention in reducing depressive symptoms and improving mental health outcomes. Methodology, so we do the research on a lot of the things on the internet, and we select research from 3 major databases: the Google Scholar, the PubMed, and the Scopus, using a lot of different keywords in the PICO things. The population, we selected adolescents, teenager, youth, young adults to correlate with our interest in the medical students, intervention as a diet, Mediterranean diet, Nordic diet, processed food, and plant-based, to see if there is any of the outcome that associate with this thing. And then the study design, we use a randomized control trial as a main study design that we use to analyze all this thing. At the end, we analyze 11 studies that include in the final reviews. And we use the EndNote 21 to organize the data. From the data, we gain like 7,815 research, and it's come from the Google Scholar, Scopus, and PubMed, and then we do the duplicate things screen, and then we identify the 11 studies in this thing. So what are the results that we see? The result is that, I will summarize it in 3 things. The first thing is that the dietary intervention reduced depressive symptoms. In one of the studies, the SMART trials, participants on a Mediterranean diet experienced significant improvement, with 32% achieving remission, compared to 8% in control group. The HAFIMED study reported reduced depressive symptoms and sustained mental health improvement with a Mediterranean diet and supplement with fish and oil. And also, there's another study in China. It's about the almond-based low-carbohydrate diet that also showed improvement in depression over 3 months. The mechanism of action. So all of the research that we looked through, they mentioned the common thing is that it includes reducing systematic inflammation, enhanced gut microbiota diversity, and improved neurochemical regulation through the key nutrients like omega-3 fatty acid and antioxidants. About the population distribution, most studies focus on adults aged 18 to 65 in Western countries, highlighting the gaps in research on adolescent non-Western population and individuals with severe depression. All of this research, they done a lot of study on the Australian and the Chinese people. So in conclusion, our finding highlights the significant roles of dietary patterns in the managing and preventing depression. Diet rich in the whole minimal processed food like the Mediterranean and Nordic diet can elevate depressive symptoms through mechanisms such as reduce inflammatory and improve gut-brain axis function. However, there is the several limitations. For once, the short study duration, since we mainly use the RCT study duration, it runs through 6 months to 12 months. And then the heterogeneous protocol and definition of hinder comparability, and underrepresentation of diverse population, which would make its application in the Thai population a bit difficult. I believe the future study should address these gap prioritization, standardization, and long-term intervention in broader demographic representation.
Thank you very much. Such an interesting topic. So, do you have any comments or any questions?
What is your next step in this area of research? I mean, suggestion for the further study in this area. What is your suggestion?
What is my further work on this thing? So I believe that as a medical student, we are exposed to the community medicine, and we believe that in the behavioral adjustment of people, which also means that we believe in the behavioral adjustment of the medical student, which means our friends and our colleagues. So policy recommendation to the faculty, maybe healthier snacks that here and there in the common rooms that will be started. And we use this as a evidence that, well, we did the research. So you should, well, maybe some funding on this thing.
It's quite interesting, the further plan, and I think we still need more research on this one. This one is quite a hypothesis. I mean, you get the research question now,
Yes.
and it might be the next step that try to confirm the thing that you sure that it will be useful. From this one, could you give me some example of the research question? I mean, further research question again about this area.
Could you elaborate more on the question?
Yes. After your paper, for the researcher, not in terms of medical student, for the researcher, if they would like to do the research in this area, what they should do on this topic?
I would recommend for Thai medical student or just
Or for the researcher?
For the researcher, I believe including multiple medical school would be nice. Because, well, there is a disparity in a lot of medical school, like one in Bangkok and one in other provinces. The result may be different because, well, in this research, from what I read about it, they account for the different socioeconomic things and, well, behavior on our people. So that to interfere with the result that the diet really improved with the depressive symptoms. So I believe, well, study in multiple medical school would help.
Okay, just thank you so much.